The walking pattern is studied as a gait cycle, which is the point when the foot first makes contact with the ground to the point when the same foot contacts the ground again. The gait cycle is broken into two phases: the stance phase, which accounts for 60% of the gait cycle, and the swing phase, which accounts for 40% of the gait cycle. In a normal gait cycle, during the stance phase, the iliac crest of the raised leg during ambulation will remain level or slightly elevated in relation to the opposite side. However, if an individual has inadequate strength in their abductor muscles, they will exhibit a compensatory pelvic drop on the side contralateral to the raised leg. This abnormal gait pattern is known as Gluteus Medius Gait or Trendelenburg Gait. As its name suggests, Gluteus Medius Gait is caused by a neuromuscular weakness in the important abductor muscle, the gluteus medius, contralateral to the side of the pelvic drop. Weakness of the gluteus medius muscle and a positive Trendelenburg sign have several potential causes, such as neuronal injury to the innervation of the gluteus medius muscle, the superior gluteal nerve. Individuals can also develop a positive Trendelenburg sign due to pathologic conditions or atrophy of the gluteus medius, such as after extended periods of disuse. Furthermore, Gluteus Medius Gait can be seen in patients post-medical surgery. For instance, hip replacement surgery requires the gluteus medius muscle to be cut for exposure of the joint, thus leading to abductor dysfunction. Here, our patient is ambulating with a normal gait pattern. Take note of how her hips remain level throughout the gait cycle, leading us to believe she has adequate abductor strength. Here, you can see that whenever she bears weight and loads on her left foot, her right hip drops. Therefore, the gluteus medius muscle on her left side has an inadequate amount of strength. In an attempt to lessen the pelvic drop seen during Gluteus Medius Gait, individuals will sometimes compensate by leaning over the affected hip in an attempt to pull the center of gravity over the hip and reduce the muscle force required to stabilize the trunk and pelvis, therefore reducing pelvic drop. A solution for correcting Gluteus Medius Gait would be to receive physical therapy to address the weakened gluteus medius and other abductor muscles. The goal of the prescription of a therapeutic exercise and conditioning program would be to gradually enhance motor control, endurance, and strength in these muscles. The first phase of therapy would consist of basic non-weight-bearing and weight-bearing exercises. Our patient is seen here performing clamshell exercises with and without a Therex band. Other exercises may include side lying and standing hip abduction, and as seen here, single leg balance exercises. Phase 2 involves the progression of weight-bearing and stability exercises. This could include stepping or hopping exercises, reducing the width of the base of support, increasing the height of the center of gravity, and performing exercises on an unstable surface. Here, our patient is performing sidestepping exercises with a Therex band. Here, our patient is increasing the height of her center of gravity by performing a single leg stance while raising hand weights above her head.